White discharge during early pregnancy. Observing white discharge during early pregnancy raises many questions in the minds of pregnant women. Many women often complain of observing white discharge during early pregnancy. A few think of it as an early pregnancy symptom. Those who think so are absolutely right, and those who are still worried about the thick, white discharge can continue reading the following paragraphs. Causes of discharge when pregnant. The odorless or slightly smelling, thick white discharge in pregnancy is called leukorrhea. This is absolutely normal and thought of as an early sign of pregnancy. This milky discharge is due to the increase in estrogen levels in your body and more blood flow to the vagina. Many women experience an increase in vaginal discharge while they are pregnant. The creamy discharge in early pregnancy is very common. The discharge is made up of the old cells from the cervix and vagina along with the normal flora of vaginal bacteria. This helps in prevention of any infection that may travel up the vagina to the womb. During the last days of pregnancy term, one may experience a different kind of discharge. One may pass a thick discharge, that may be quite heavy and give you a feeling of accidentally passing urine. This is due to the thick discharge during pregnancy that fills up the cervical canal and make up a protective barrier called the mucus plug. When the cervix begins to thin out and dilate, the mucus is expelled. This mucus looks like a creamy white discharge or may be released altogether in one gelatinous blob. You may notice a little bit of blood along with the discharge. This may be a sign of start of labor and you need to get prepared for the baby to arrive anytime soon. Is it normal to have discharge when pregnant? Is it normal to have white discharge during early pregnancy? This is one question that runs through a expecting mother's mind. It is perfectly normal to pass discharge when pregnant. This discharge should be clear and creamy or milky white in color. Discharge during ovulation may be as thick as egg whites and have a slightly creamy texture. However, if you have thin and clear watery discharge during pregnancy that too a lot of it, it may be a sign of leaky amniotic fluid. You need to consult your doctor and clear off this doubt. An odorless discharge along with itching and burning near the vagina as well as inflamed vulva may be a sign of yeast infection discharge. Any discharge like yellow discharge, green, gray, with or without foul smelling, or smelly discharge and frothy texture may be a sign of vaginal infection or sexually transmitted disease. You should speak to your doctor about it and get this problem corrected. If you observe increase in discharge or discharge along with some mucus-like substance or blood during or before your 37 weeks of pregnancy, call your doctor. This could be a preterm labor sign. What to do about discharge when pregnant? There is nothing much that one can do about the discharge. You should maintain good genital hygiene as well as wear clean cotton underwear. Do not wear tight pants, scented pads, nylons, or use deodorants and scented soaps. Completely avoid douching as douche will cause imbalance of the normal vaginal flora. It may lead to infections or introduce air into the circulatory system through the vagina causing serious complications. This was some information related to thick, white discharge during early pregnancy. It is very normal to experience discharge and is usually one of the 10 signs of pregnancy. If you have any doubts, speak to your healthcare provider.